Let's learn about the skeletal system and skull. Before we begin to learn about bones, let's review a few terms that describe landmarks on bones. A tubercle is a small knob-like process. A tuberosity is a knob-like process larger than a tubercle. A trochanter is a large process. A styloid is a pointed process. A foramen is a hole or opening in bone. A sinus is a hollow cavity within bone. And a condyle is a rounded process. The entire skeletal system is divided into two main sections. The axial skeleton contains the skull, spine, rib cage, and sacrum. The appendicular skeleton contains the arms and legs or extremities. Let's look at the skull in more detail. Here are some bones seen in the anterior view of the skull. The frontal bone is the most superior bone in this view. The zygomatic or cheekbone is here, as well as the maxilla and mandible or jaw. We can also see a portion of the sphenoid and ethmoid bones and the nasal bones. In this lateral view, we again see the frontal, maxilla, and mandible, as well as the parietal, temporal, and occipital bones. We also see a portion of the sphenoid bone in this view. In this posterior view, we see both parietal bones and the occipital bone. In this inferior view, we see the hard palate, which consists of a portion of the maxilla and palatine bones. We also see the vomer bone, which forms the inferior portion of the nasal septum, and the sphenoid, temporal, and occipital bones. In this superior projection, we see the frontal and parietal bones. The skull bones are connected by sutures, a type of fibrous joint. Here we see the coronal suture and the sagittal suture. We also see the coronal suture on the lateral view. Here is another suture known as the squamous suture. The lambdoidal suture connects the occipital bone to the other skull bones. If we remove the top of the skull and look inside, we can see a few more structures. The sphenoid bone extends across the floor of the skull. An important landmark on the sphenoid bone is the sella turcica, where the pituitary gland resides. We also see some holes or foramen in this view. The foramen ovale carries nerves for the jaw area. The foramen lacerum carries small blood vessels. The foramen magnum is where the spinal cord exits. Some other structures include the crista galli and cribriform plate of the ethmoid bone. Here is another look at the zygomatic arch. The zygomatic arch consists of the temporal process of the zygomatic bone and the zygomatic process of the temporal bone. The TMJ or temporomandibular joint is the jaw joint. The external auditory meatus or canal is the opening for the ear. Other landmarks on the temporal bone include the styloid process and mastoid process. Both are sites for muscular attachments. Here is another look at the inferior to superior view. In this view, we can see the zygomatic arch, foramen ovale, foramen lacerum, carotid canal, and foramen magnum. We hope you have learned something about the skull, and see you next time.